Thank you on behalf of the International Society for Quality of Life Studies for joining this webinar titled ISQOLS webinar, Insight on Social Connections and Loneliness in OECD Countries, presented by Carrie Exton. And now, to present our speaker, Carrie Exton is a senior counselor for the OECD WISE Centre. As deputy to the director, she supports the overall leadership of the centre, providing strategic advice on developing the evidence base for more inclusive, sustainable, and people-centered policies. This includes guiding technical work to develop and analyze data on economic, social, and environmental outcomes beyond GDP, alongside advancing policy tools to improve well-being and support equal opportunities. Carrie also oversees the centre in-depth work on subjective well-being, mental health, and social connection. She headed the Wellbeing Data Insights and Policy Practice team in WISE from 2017 onwards. This included leading the How's Life series of reports that I've read myself a lot, growing the OECD's work on well-being policy, and spearheading research on well-being during the COVID-19 pandemic, and measuring OECD's countries' progress towards the UN Sustainable Development Goals, also known as the SDGs. Prior to joining the OECD in 2011, Carrie was a government policy advisor in the United Kingdom Civil Service, including roles in strategy, private office, higher education, research and science policy, and the apprenticeships unit. A British and Canadian national, she holds a doctorate in experimental psychology from Oxford University. Without further ado, Carrie, I'm gonna give you the floor, and thank you very much again for being with us today.
Thanks so much. So I'm just getting my slides up on screen here. And I just want to say a big thank you to Anthony, Roger, Francesco, and Jill, if you're there in the background, for the invitation. And it's a real pleasure to be with you today. I also want to say a big thank you to my colleagues, Jessica Mahoney and Lara Fleischer, who are leading the OECD's work on social connectedness and who developed most of the analysis that I'm going to share with you today. So, just to start perhaps with a few quick words about the OECD WISE Centre for those who don't know us already. This week is actually a very special week for the WISE Centre because we're celebrating our 5th birthday. And some of you know that statistical work on well-being beyond GDP has a really long history in the OECD, dating back more than 20 years. And the WISE Centre is very much building on that long legacy. But we were also created to build a closer connection between those statistics and the OECD policy advice that is based on those statistics. So this slide is very rich, and I won't go through every bullet. It's more of a reference to share some of our most recent work with you. But what I will highlight briefly is these 3 high-level pillars that you see here in orange. So first of all, our work monitors living conditions, distribution and sustainability across our 38 member countries and actually a number of partner countries as well. So this includes all of the corporate OECD data sets that the WISE Centre is responsible for collating and maintaining, as well as the analysis, data visualization and reporting that we do based on those data sets. So you can see this ranges from more granular measures of economic well-being at the household level, so things like our income distribution and wealth distribution databases, as well as a really wide range of social and sustainability trends and outcomes as well. We also provide in-depth analysis on topical policy issues, anything from cost of living pressures for families with children, through to the impacts of digitalization on child well-being, promoting well-being and mental health as joint policy objectives, through to things like work on inequality of opportunity and social mobility. Finally, at the bottom there is this foundational strand to our work, which is about building the core evidence infrastructure on well-being, inclusion and sustainability within our member countries, as well as the types of policy tools that are needed to apply this kind of evidence. So this includes some really technical work with our statistics committee to develop things like measurement guidelines, documenting country practices and learning lessons. And it also includes extensive efforts on our part to support knowledge exchange sharing across both statisticians and policy practitioners in our member countries, through activities like the knowledge exchange platform on wellbeing metrics and policy practice. And for those who have more interest in these areas, I've provided a couple of hyperlinks that do get in touch if you want to know more. So this slide situates the work that I'm going to talk about today on social connections and loneliness within the wider OECD wellbeing framework, which is a tool that we first developed back in 2011. So this framework covers economic, social, and environmental outcomes for people both here and now, today, as well as the systemic resources that support well-being for future generations. And in addition to this wide-ranging multidimensional view, we also include a more granular focus on inequalities and vulnerabilities, including outcomes for specific groups, so by age, by gender, by education, for example, as well as looking at the overall shape of the distribution for a number of outputs. Now, we sometimes describe the dimensions that you can see here as the key ingredients for a good life, because that's really what we're trying to capture with this framework and the different dimensions that you can see highlighted here. So, and if you've got good eyesight and a big screen, you'll be able to see that social connections, highlighted in the middle there, is very much one of those ingredients for a good life. So social connections is something that we've been featuring in our work on wellbeing back since our first comprehensive publication on wellbeing, which was How's Life in 2011. So they have been a core feature of our work from the beginning of this sort of statistical activity. What do I mean when I say social connections? Well, in a nutshell, social connections cover the ways people both interact with and relate to one another. So as shown here, they include both the quantity of our connections, so things like how much time we spend with other people, how much time we spend alone, and the makeup of our social networks, as well as the quality of people's connections. So how we feel about the support that we give and receive, how lonely we might feel, or how satisfied we feel with our key relationships. Now, there's an extensive research literature that suggests poor outcomes on social connections can have a range of important implications, both for the individual concerned as well as societal costs. For example, loneliness and social isolation have been found to be associated with a higher risk of developing physical and mental health conditions, poorer job performance and lower productivity, a higher risk of unemployment and dropping out of school, as well as actually some interesting evidence suggesting that loneliness also shapes voting behaviours. On the other hand, supportive social networks are often associated with better health and feeling happier, with better job satisfaction and creativity at work, with higher academic achievement, as well as, again, some interesting evidence suggesting that community ties can provide resilience in the face of things like climate disasters. So, as you can see from this slide, more and more OECD countries are establishing national or subnational social connections initiatives. In some countries, such as Austria, Germany, the Netherlands, and Sweden, they've developed national strategies or platforms against loneliness. In other cases, we've seen senior figures, such as government ministers, appointed with a dedicated role for tackling social isolation and loneliness. And in other cases, social connections have been integrated into wider mental health or social connections initiatives, or well-being initiatives, that should be. So there is also a growing community of international cooperation, and the OECD is collaborating with many of these initiatives, such as providing inputs to the UN measurement initiatives on social connectedness, showcasing data from the European Commission in the report that I'm about to talk to you about, as well as closely exchanging with the World Health Organization's Commission on Social Connection and the Global Initiative on Loneliness and Connection. So there's quite a lot of international and multilateral activity in this space, as well as a focus of national policy making. So this is a pretty hot topic for many of our member countries. So in today's talk, I'm going to focus on key findings from two recent OECD publications. The first is this paper, which is all about OECD country practices in measuring social connections, which is something that we published in September 2024. So the main core of this paper involved reviewing national surveys across our 38 OECD member countries, basically with the goal of better understanding how national statistical offices are capturing evidence on people's social connectedness. We also looked at practices across 9 different international surveys, including the Gallup World Poll, the World Values Survey, the OECD's own PISA study, as well as a variety of European survey vehicles. So the resulting paper is very rich and full of really practical details on how different aspects of social connections are being measured. But I'm going to share with you a couple of key takeaways from that paper this morning. The first key message is that all of our member countries are already measuring social connections in some shape or form in national surveys. So this is good news and perhaps quite surprising for those of us who've been in search of high quality data on this topic for many years. However, as you can see in this slide, there's a great deal of variety in the types of measures that are covered. And there is no one type of measure that everybody is collecting. So we've categorized the different measures here into measures of structure, function, quality, as well as communal aspects of social connections. And there's more detail in the paper about how we've made these classifications. But essentially under structure, we've grouped measures that address structural aspects of people's connectedness. So things like time spent with others, the type of social contact that people experience regularly, as well as network composition. So attempts to look at the breadth or depth of people's regular network of contacts. Under function, we're looking at what people perceive they are getting or giving to relationships, whether that's social support on the one hand, which is something that we both give and receive, as well as things like loneliness, which is about how people feel about the degree of connection that they have. Then under quality, the next band of measures, we're considering things like satisfaction with relationships, as well as the emotions that people experience when they interact with others. And finally, under communal social connections, we're considering measures like sense of belonging, connections to the local community, and feelings of acceptance or discrimination. And the light pink bars on this figure show the percentage of national surveys with these types of measures included. The darker pink bars show the percentage of international surveys we looked at that include each type of measure. So, some types of social connections are clearly more likely to be connected than others. So, for instance, across all the surveys that we considered, indicators relating to spending time with others are the most likely to be included, along with indicators of social support. And so these are present in around 2/3 of the surveys that we looked at. If we contrast national measurement practice with international surveys, the differences in coverage are most evident, I would say, in the structural category. So international surveys are comparatively less likely to include indicators on time spent with others, as well as detail on the type of social engagement, as well as network composition. So these are things that are more likely to appear in national surveys, things like general social surveys, than they pop up in the international survey sphere. However, international surveys are a bit more likely to include some of the community connectedness indicators, especially things like sense of belonging, which are relatively rare in the national surveys. So another message is that despite being the centre of much of the policy focus we've seen in recent years, loneliness is actually less likely to be measured than several other types of social connection. So there's maybe a bit of a gap here between the policy focus and the measures actually being produced in national statistical offices and by international surveys. Now, of course, a loneliness strategy might consider policy measures that cover a really wide array of social connections, from support to isolation to community well-being. So loneliness, we know it's a common turn of phrase, and maybe policy initiatives are just using it as shorthand rather than being very sort of literal in the interpretation. But one of the things we do know from looking at the research literature is that different facets of social connection are not perfectly correlated with one another, and their relationships with other aspects of people's well-being can also be rather different. So it's possible, for example, to live in a socially isolated way without necessarily feeling lonely, just as it's possible to sustain many different relationships without feeling that any of them are particularly supportive. So at the moment, the research base is pointing to the value of measuring these facets separately wherever possible, or at the bare minimum, at least having a measure of quantity alongside a measure of quality if there's survey space to do that. So, and if the policy priority is truly about combating loneliness, rather than, say, tackling social isolation, it's worth measuring these separately, and the target populations of greatest interest, including those who are most rapidly deteriorating on these outcomes, might also shift depending on the focus of the measure. A second big message coming out of this analysis is a lack of harmonisation, both across measures and even within conceptual areas. So this means that basically the large majority of national data collections are not at all comparable. So for those of us with an interest in how different policy environments can shape people's social connectedness, the only source at the moment that is comparable and harmonised across countries is those limited international surveys. Items used in countries vary in terms of question phrasing, response scales, recall periods, you name it, they will be different. So I think this is important because these are all features of survey design that really do shape the way that people react and answer to questions. So this lack of harmonisation really has a material impact on the comparability of the end results. This slide shows some selected examples of loneliness survey items. Again, I won't read this out, but we'll make sure that we share the slides for anyone who wants to look at this in greater detail. From the OECD perspective, these are the types of conditions where we think it makes sense for us to try and develop some guidance for countries on good practices so that we can drive better data availability, quality, and harmonisation. Because until this situation improves, anyone doing comparative work, including the OECD, the WHO, and a variety of international organisations that are increasingly active in this arena, we will all continue to have to rely on unofficial data that often features small samples and limited questions that are not necessarily always meeting the policy needs that are identified by our member countries. So I think there's some work to be done here in terms of understanding and then converging around good practice. A third key message is that the type of survey vehicle influences the type of social connections data collected. This is probably a bit obvious, so I won't dwell on it. But for example, time use surveys rarely include measures about the function of relationships or communal relatedness, for example. On the flip side, general social surveys are most likely to include questions around function, so meaning questions about social support and loneliness, for example. The fourth key message, which I'm going to put less diplomatically than the title of the slide, is that we have a problem with data frequency. We know that data frequency, timeliness, and granularity are all important for the policy uptake of these types of data. Even if headline national averages might not move a lot in normal times, I think we're not really living in normal times for a lot of our social indicators, and key decision makers will simply ignore data points that look too old or that relate to the previous political or economic cycle. And yet we still see that annual data collection, which is considered a bare minimum level for the vast majority of economic indicators, is definitely still the exception rather than the rule. Irregular or one-off data collections are quite prevalent in the surveys that we looked at, although thankfully most general social surveys do have some regularity to them. Time use data, which we know are very valuable for capturing many different facets of people's well-being and living conditions, tend to fare worst of all, making them really quite hard to use to capture evolving societal trends, and with the kind of regularity that means you know you're actually looking at a trend rather than just a blip in the data. And speaking of trends, our fifth key message is that understanding the impact of factors such as digitalization and demographic trends on social connections will be increasingly important. And we're starting to see some innovations in survey design to address these kind of factors directly. A final key message that you won't actually find in the paper because it relates to slightly more recent developments in the international statistical community is that there is a special focus at the moment within the United Nations, thanks to a group called the Friends of the Chair Group on Social and Demographic Statistics, which is currently developing a set of recommendations to help upgrade the system of social and demographic statistics used across countries. The OECD has been contributing to this activity together with a really wide variety of international organisations and again, particularly national statistical offices. And we've been contributing, especially when it comes to the building blocks that you see on the right-hand side, connected with both relationships and with social and demographic outcomes, which has a lot of common ground with some of our wider well-being work at the OECD. So there's an important opportunity here to build on the emerging consensus about the importance of these statistics by improving their availability, their quality, and their harmonisation across countries, which is something that, again, in the field of economic statistics, we're quite advanced. In the field of social and demographic statistics, we are less advanced, but there is some really important building blocks to work from. So on this hopeful note, I'm going to turn to the second report that I'm going to speak about this morning, which we released just last month. So this focuses on what the data we do have today can tell us about the state of social connectedness in OECD countries and a little bit about how they've been changing over time. So while the data situation isn't perfect, our publication is still the first international report to provide a comprehensive assessment of the state of social connectedness in OECD countries. It uses high-quality data from large sample surveys, combining data from national statistical offices on the one hand with cross-country international surveys on the other to cover a range of different social connectedness outcomes. And importantly, using high-quality large sample data also allows us to look at inequalities, so who is most affected by disconnection and whether those outcomes are changing over time and whether those outcomes are, the gaps in outcomes are narrowing or widening over time. So the key findings are summarised here, but I'm going to take you through them in greater depth over the next couple of slides. In brief, social connections are generally pretty strong in OECD countries, but in recent years there have been changes in how we socialise with each other, as well as how we feel about those interactions. And the report identifies population groups that have traditionally been most at risk of poor outcomes, while also noting that recent years have exposed new vulnerabilities, so new groups of people who are facing challenges to their social connectedness. The report ends with a discussion of some of the policy-relevant drivers of social connectedness, including digitalisation, as well as community-level interventions to improve social connectedness. So first, we should note that most people in OECD countries do report quite good social connectedness. In 2022, 95% of people in OECD countries said that they interacted with friends or family over the past week, and 90% felt that they had someone to count on in times of need. More than half reported that they never felt lonely over the past month. That said, there is a substantial minority of people who are disconnected, sometimes in quite severe ways. So 10% of people in OECD countries say that they have no one to count on in times of need. 8% of people report having no close friends at all. And 6% of people felt lonely most or all of the time in the past 4 weeks. So these are some quite extreme examples of social connectedness deprivations in OECD countries. Over the past 10 to 15 years, the frequency of in-person socializing has been steadily falling. This is true for both seeing friends and for seeing family members that you don't share a house with. At the same time, the number of people who stay in touch with family and friends over phone, text, or social media has been rising. Now, again, those with sharp eyes or watching this on a big screen will see that the final data point on these trend lines is 2022. So there is a possibility that this has been shaped by changes in behaviour following the COVID-19 pandemic of the preceding years. But you might also be able to see that the previous data points in 2006 and 2015 long predate the pandemic, and we can see that those trends are already emerging in those earlier data points. So we think that there's probably something structural here rather than just picking up the shock of the pandemic. Now, time series are much shorter for aspects of relationship quality. However, between 2018 and 2022, the number of people without social support or the number of people dissatisfied with their relationships rose. The changes are quite small, and obviously these data points are much more COVID adjacent, so continued monitoring is needed to understand whether these outcomes will rebound and whether we're looking at a genuine trend or more of a blip in the data. In countries with comparable data, rates of feeling lonely remained relatively stable in the short term. However, if we take a closer look, particularly at the ends of the distribution, we'll see that the number of people, for example, who report that they never feel lonely has actually fallen. So from 59% in 2018 to 51% in 2022. So this is, again, something that we think is worth keeping an eye on, but is far from conclusive in terms of a long-term trend. Many of the recent deteriorations that I've noted are driven by younger people and men, quite often younger men. So interestingly, these are the groups that have traditionally experienced better outcomes on a number of these measures. As you can see from these figures, younger men saw the largest drop in in-person socializing with friends and the largest increases in both feeling lonely and feeling dissatisfied with their relationships. While it's important to acknowledge newly at-risk groups, it remains true that populations who've traditionally been lonelier and more isolated are still vulnerable. For example, compared to the overall population, people who are unemployed or have lower incomes are around twice as likely to report feeling lonely. People who live alone are 1.5 times more dissatisfied with their relationships. So it's not simply that they are isolated because they are living alone, they are less satisfied with the relationships that they do have. And the elderly are more socially isolated. So 11% of elderly people in OECD countries say that they never meet friends in person in a typical year. That's 11% who never meet friends in person in a typical year. That's quite huge, and again represents a really severe form of social connectedness deprivation. And this is more than double the rate that we see in the general population. So turning briefly to drivers of social connections, we know from the literature that these are complex and multifaceted, but what we do also know is that they are partly structural. So this means it's not just to do with individual tastes and preferences, some people seeking out more connectedness than others, some people with more extroverted personalities than others. There are structural factors that shape people's access to connection, and this means that there is a space for policies that can facilitate more fulfilling social interactions. Much of the existing research that we've looked at has focused on interventions that target disconnected or lonely individuals. So again, a very individual focus. But more and more of the new loneliness strategies that we're seeing in our member countries are looking at program level, community level interventions. And this is especially relevant in light of overlapping demographic trends that could influence how people connect, including things like aging populations, more people living alone, which is certainly a trend that we're seeing in Europe at the moment, and our increased use of digital technology. So one policy avenue is to look at improving access to high quality social infrastructure. So these are physical spaces that might be publicly or privately provided that encourage social interactions. And they include things like public institutions, libraries and public parks, community organizations that provide places to come together, as well as commercial establishments, things like cafes, barbershops, bookstores. And research shows that people who use social infrastructure are generally more socially integrated, healthier, and more socially mobile. The growing number of people who are living alone, especially older people, might particularly benefit from frequenting social infrastructure more regularly. But that means that we need to pay particular attention to some of the barriers that older or more disabled people may face in terms of getting out of the house to access social infrastructure in the places where they live. At the moment, the report outlines the different ways that data producers can capture information on social infrastructure and access to it so that we can build a more accurate picture going forward to shape policy in this area. As you'll hear in a moment, policy responses to combat loneliness is an area where we'd like to do more work in the future, but we've already, through the work that we've already done, started sort of spotting a few case studies of practical interventions to support connectedness. And these focus on both community and individual level interactions that address social infrastructure and barriers to connection. So things like guiding people towards the third spaces that are already available in cities. So there's an example in Paris of guiding people towards places where they can meet and socialize in accessible and affordable ways. It includes things like the creation of safe, welcoming spaces that enable really low-key interactions that can provide particular support for vulnerable people who may struggle to access more intimidating social environments. So this includes things like the Soul Mind convenience stores where people can go and get food and just sit and spend time with others. It includes things like multi-generational housing initiatives in Germany, or providing accessible transport options for senior citizens to help them attend social activities in the UK. So as we saw earlier, all of us are increasingly using digital technology and social media to facilitate and enhance our social interactions. And many policymakers, parents, and teachers are also increasingly concerned about the role that these interactions are having in shaping our social life, especially for younger people. Now, the report identifies 3 key questions in this area where we think we need better research before we can guide policymakers in a way that is conclusive or at least useful. So first of all, understanding the effects of different types of online behaviours. It's quite clear that there is a difference in the impact of active chatting versus passive scrolling, for example. Second, we need to know more about what the shift from real world to digital interactions means for the quality of our connection and how those interactions make us feel. So you'll see in the previous slides that the frequency of in-person contact is falling, the frequency of digital contact is rising. What does that mean for the quality of those connections? We'd like to see more research in that area. Finally, we'd like to better understand how efforts to regulate young people's use of social media and digital devices is actually having an impact on their social connectedness. So, for example, we're seeing some countries or municipalities trying to ban phones in schools. And in addition to the outcomes that this might be having on things like attention, academic performance, it's also important to understand what this is doing for people's social connectedness. So this is really about getting those evaluation studies designed right and making sure that when we're thinking about the impact of, or the intended impact of these types of policy interventions, we're thinking very broadly in terms of the possible outcomes that they might shape, including people's ability to interact. So I think it's fair to say that in this area, the lack of evidence means we have more questions than answers for these topics at the moment. But I do think that existing work is really helping us zero in on the targeted research questions and getting the evaluation of these policy initiatives better and more useful going forward. This really brings me to my last slide, which summarizes possible future directions for WISE work on social connectedness. As I mentioned earlier, we're considering whether it would be helpful and whether the evidence base is mature enough for us to consider developing some measurement recommendations or some guidelines to accelerate the availability of high quality and internationally comparable data on this important topic, because it's gaining a lot of policy attention at the moment. So we think it would be really helpful to improve the evidence base by improving the data. We're also keen to take a systematic and pragmatic view on which policy interventions are working most effectively. So with the really wide array of loneliness strategies that are currently being implemented across our member countries, we're in a good place to start trying to look at which one of these are delivering results and why. Another topic that has been flagged to us is the major digital transition currently underway in government service provision. So everything from community post office services through to digital doctor's appointments, or help in finding a job or in seeking training. So many of these activities are shifting to digital provision, which has many implications for their wide-ranging accessibility and their affordability. But there are some interesting questions here about how to ensure a person-centered and human experience that still fosters social connection and trust when delivering services in these different modalities. As just mentioned, we know there is a strong call for more evidence on child and youth mental health and social connection in the digital age, including about the type of support and training that adults in children's lives can provide to help protect and empower them online. And finally, across a number of our wellbeing indicators, we're seeing deteriorating outcomes for young men. And we think this is probably worth a closer look, especially when it comes to things like social connectedness and sense of belonging, as well as mental health and civic engagement, to name just a few. So in the time that we have left today, we'd really love to hear your feedback, both on the work we've presented today, but particularly on these future research directions for WISE. The menu is a long one and resources are tight, so we will not be able to do all of these activities in the coming years. But we'd especially like to hear about any research findings on these specific topics that you would be able to share with the OECD. My email address is on the next slide if you want to reach out, or I think if you post links in the chat, we're going to be able to capture those. So please do go ahead and share any links that you can. We'd really like to know if this menu of topics resonates with your work and feels like the right priorities, particularly knowing what you know about the OECD, if you know us at all. Obviously, different actors in the research community can take on different roles. We're trying to make sure that we're being useful as an international organisation that focuses on comparative research primarily. And finally, we're really keen to hear about your own experiences of measuring social connections and what question formulations have proved most meaningful in your own research. So with that, I will hand the floor back to you, and looking forward to the conversation.
Thank you very much, Carrie, for this excellent, important, and inspiring presentation, as always. We will have now the privilege to start this Q&A session with Francesco Sarracino, that he will start with some insights. And after Francesco's insights, if anyone wants to ask a question, you can turn your camera on if you wish, or raise your hand, and you can ask directly to Carrie, or also you can write your question in the chat bar. Thank you very much again, Carrie. It was excellent.
Yeah, great. Thanks, Roger. Indeed, thanks a lot, Carrie. That was really inspiring work. It's a terrific piece of work. I think it's going to be very important for our community, and is going to become an important reference for to frame the work of many of us working on the quality and quantity of social relations and their importance in quality of life. Your presentation was extremely rich, and we could open a chapter on many of the items you raised. But I'll try to kind of following up on your invitation on raising on the questions you raised, and well, the first reference that would come to my mind while looking at, for instance, policies or experiments and evaluations of interventions that have been done, the first reference that would come to my mind is the work by, for instance, Lara Aknin and colleagues, who have been doing some experiments in school with children, also fairly young children, and showing how having them doing some pro-social activity improved their well-being and then their other social outcomes. There was a particularly interesting experiments where they matched a group of children with a group of elderly people, and they were basically helping each other. Elderly people were helping the young with their homeworks, and the young people were helping them with other chores. And they, at the end of the day, the study documented that the children that took part into this experiment had significantly more positive outcomes than the control group. So there is a lot of this evidence. Another intervention that has received mixed feelings is social prescribing. Which is an initiative. I don't know if everyone online is familiar with social prescribing. It is basically a medical initiative available in UK, where a GP can recommend a patient to a social cure. So especially if you have some mental problems or beginning of mental problems, the GP can recommend you to a link person that then can associate you with social initiatives. That could be anything from attending dance classes to gardening to joining some social groups. And there is a lot of debate about the validity of this tool. And most of the debate is due to the fact that there is no well-established evaluation of the policy. Although I've seen some recent studies that seem to support the efficacy of prosocial behavior, not least by our own Ekaterina Oparina. And this links me to your first point on the guidelines. I think that the guidelines you're proposing are could be very useful, because the first guidelines on well-being that you produced in 2013 have been to measure well-being have been extremely important, functional in helping us pushing forward the agenda of quality of life in the public debate and in policy making. And I think that guidelines on measuring social connections, as you're proposing, could have a similar impact and would be very helpful for practitioners. Similarly, however, you might also consider kind of having some guidelines on how to make this policy evaluation. Because while policy evaluation is very well established among some social sciences, not least among economists, there are a lot of people outside of our walls that do policy evaluation in a much more artisanal way. And this is at the origin of why most interventions that you've seen applied in the real world do not have a very good empirical support to establish the size of the impact. I'm thinking here about various structural, I think you would call them structural interventions, through which, for instance, cities have reorganized their public spaces, introducing super areas. I think Barcelona, Roger, you may correct me, I think Barcelona is one of the cities that in Europe has adopted this idea of the super block. So kind of 15-minute network in which people can walk free from motor vehicles. But then these kind of interventions have received scattered or at least imperfect evaluation. So I'm totally in support of the guidelines. And now the other thing I also believe is extremely helpful looking forward is this well-being and social connectedness of young men, because, well, we've seen, for instance, that there is a link between prosocial behaviors and death of despair, and that the death of despair, as you pointed out, are more frequent among men, especially young men in most countries. Even if we exclude mortality, young men are still at risk, a higher risk of adopting risky behaviors. So try to understand what is going on in the social life of young men is extremely important. And at the same time, it is also extremely challenging because I don't know if it is some form of inherited machoism, but it looks like it's more difficult to get the truth out of men when we ask them about their social connections. And so it would be also helpful in the guidelines to reflect about which kind of tools are better for which kind of audience we're trying to target in our surveys. Last thing, and then I am ready to give back the floor because I'm speaking too much, is that I want to flag that the next World Happiness Report that will be published in 2026, March 2026, is dedicated to online social media. So there will be a lot of new updated results coming up from the crowd at the World Happiness Report. And with that, thank you so much again for your work and looking forward to having more of it.
Carrie, you want to answer?
Sure. I mean, there was a lot there, and a lot for me to agree with Francesco also. So I think on policy interventions, I think we've got a wealth of evidence about other outcomes for well-being. But I think very specifically what we're missing at the moment is good evidence on what a policy intervention does specifically for people's social connectedness as an outcome in its own right. And I think I very much agree with you that there's a gap here in terms of evaluation practices that would be really helpful to look at. And some of the work that WISE is doing for our knowledge exchange platform on wellbeing metrics and policy practice is very much considering how do policy tools like cost-benefit analysis, ex-ante appraisal, ex-post evaluation, how do these tools change and what do we need to do to integrate this kind of evidence into those very classical policy tools that are sort of very well known to the economic community, but how do we broaden out those tools to look at a wider range of outcomes that matter to people? This is work that's ongoing in the WISE Centre, and I take it very well that we're missing some really high quality evaluations across a range of different social connections interventions. And that's really the next level that we need to get to for these to become serious policy targets. So I love the idea actually of guidelines on policy evaluation. I will take that away with me. I think you're right. There are some really interesting experiments ongoing in terms of intergenerational mixing, in terms of social prescribing. These are things we're seeing picked up actually in a couple of different country contexts. And I do think also that link to deaths of despair is a really important one. This is an indicator that the OECD has now added to its wellbeing framework. We have internationally comparable data on deaths due to alcohol, drug abuse, and suicide across all our member countries, and we're monitoring how those are changing over time. So I think that's a really valid link to make. I'm delighted to hear that the focus of the next World Happiness Report will be on digital connectedness and social media. Really looking forward to that. So I will watch this space closely.
Thank you, Carrie. Sedinam, if you can turn your camera.
Yes. Hello, Carrie. Thanks for your presentation. My name is Sedinam Amiku from Aston University. I'm a PhD student, and thanks for the presentation once again. I was happy that OECD has been able to flag that there is a need for community-level interventions, because my research now is looking at financial well-being, but then we always measure it from the individual angle and trying to come about with interventions that favor just individuals. But then I'm looking at the community aspect of it. So I'm happy that some part of the OECD's research shows that there are higher levels of social connectedness, though we have like a smaller amount of people who are lonely, it pleads my case that our social connections are important, and communities that are based on interest, maybe demographics, and many other reasons why people form a community can help improve people's financial well-being, or how people behave, or how financial well-being of individuals have been improved. I just want to no. If considering the entirety of financial well-being and social connectedness, is there any information that probably has not been brought to light about how social connections improve people's financial well-being? I just want to see if there is something I might not know that the OECD knows. Yeah, thank you.
Roger, shall I respond, or shall we collect more questions?
Please, if you want to respond briefly, and then we can continue with the other questions.
Sure. So I don't think that the OECD has done any work surveying the link between financial well-being and social connectedness specifically. There is a lot of work on financial well-being at the OECD happening right now, and I'm very happy to share some links with you if you drop me an email. So there is both things that the OECD WISE Centre does, in terms of measuring people's economic circumstances and living conditions. There's a really wide variety of measures that we have on economic well-being and vulnerability in households. But there's also another part of the OECD that's working on financial well-being, particularly from the financial inclusion perspective, and also interventions that can improve financial awareness and knowledge in people so that they can improve their own financial outcomes. So there's a couple of different strands of financial well-being activities happening in the OECD. One thing I will highlight is a report that we did a couple of years ago that was actually focused on the interaction between mental health and the other dimensions of the OECD wellbeing framework. And that includes specifically the interaction between mental health and an array of different aspects of people's economic living conditions. And it features some really interesting policy interventions targeting specifically things like household debt management as a way to support people with mental health conditions to cope with financial adversity. So there's both an analysis of the literature about the profound links between things like poverty and mental health experience, but there's also a component of that report that looks in depth at what policy interventions to address financial adversity can do for people's mental health simultaneously. So that's probably a useful reference, even if it's not directly on the topic of social connections. I'm happy to share those with you.
Great. We have now three insights from Agustin, Lagarde, Ken, and Danny. We will first start with Agustin. Agustin, are you here? Can you turn your camera on?
Well, yes, I'm here.
Okay.
It's just because it was interesting to talk about, like, there was a request for like relevant research, and I just note that I know that the Department for Culture, Media and Sport has just commissioned an evaluation of social prescribing of parkruns. So basically, there are parkruns is this charity that organizes community runs, 5K runs in the UK and across the globe. And now there is a range of GP practices that are linked to the local parkrun and are recommending both the patients and the kind of team at the GP practice to attend those parkruns. So that would be an interesting study to look at in terms of social connections. And I know there is similarly this charity in the UK called Good Gym, which is basically a run club, but they do volunteering activities. They're working with the LSE to evaluate the well-being impact on the volunteers. But now I know that they've changed the strategy a little bit. I'm a volunteer actually with Good Gym, where they look at combating loneliness. And so what they do is that a lot of the tasks are actually going to a person which is very lonely and helping bring in the journal. They're doing the groceries for them, maintaining the garden and things like that. So they're generally recommended by the council. But also, again, the benefit is for the volunteers because it's so easy to access that actually myself have met a lot of people in my neighborhood through that, compared to my friends that may be like further away. So that there is, I think, there is opportunities, there are good programs, there are opportunities to actually evaluate. So sometimes it's a bit tricky because we lack evaluation, but I guess it's because we lack things to evaluate. So I just thought to mention these two because they are like good sources of evaluation or things to evaluate in the future.
Thank you. Carrie, if you agree, we are going to collect the insights from Ken and Danny because we are short of time. So Ken, please, if you can turn your camera on.
I'm sorry, Roger. It's very early in the United States, and I don't think I'm quite ready to turn the camera on.
We can hear you.
I'll be very quick. I think the question is, I've got an intervention developed in communities in the favelas of Brazil that is a large group dialogic method of building social connections and social bonding around and developing emotional literacy in the process. And the question I have is, it's facilitated by community members. Question I have is are there ways for this kind of method to be brought to the attention of the OECD and developed in such a way that we can test it in other parts of the world and increase the research base as well as potentially actually use what we already know that's shown to be of use to other parts of the globe?
Thank you, Ken. We are going to have now the last insight from Danny. Thank you.
Thanks very much, Carrie. Thanks so much for that. That was really terrific as always, and congratulations to your team for doing this. I look forward to receiving the slides and learning still more about what it is that you're continuing to amplify. Just a note, and I'll send this along to you, Carrie. In Nova Scotia, Canada, we are in the midst of administering our second quality of life survey. And it's going to be in the next couple of months. Our survey, the invitation cards to participate in the survey is going to 100% of our households. That's 430,000 households with over 250 questions, substantially focused on things like sense of community, loneliness, social connections, and related issues. So, Carrie, I'll send along to you. It's in collaboration with the Canadian Index of Wellbeing. The survey questions highlighting the many questions that we're asking. We privileged the UCLA version of social connections as our question, but there's countless of others that disaggregate and point to things that help us understand intersectionally who is experiencing all the challenges related to loneliness and social isolation and much, much more around the edges of social connections. So more on that as we continue to advance this, and hopefully we'll have more to say once we've collected all of our data and make it available, not just in Canada, but beyond as well. Thanks.
Thank you, Danny. We are going to collect the remaining questions. So please, if Candice and Alexandra, you want to send us an email, we are going to be sure that Carrie can answer these questions and receive your feedback. I don't know, Carrie, if you want to make any insights or responses to the points that has been raised so far.
Sure, and I haven't, because I'm screen sharing, I haven't had a chance to look through the chat, but please do save the chat for me and I will go through it and come back to people if you leave email addresses. So just a thank you for all of the tremendous work that you're flagging. It's really, really useful. And indeed, we want to hear from you right now. If you are doing interventions and solid evaluative studies, this is really the moment to draw them to our attention, because one of the activities that we do want to do in that second bullet of looking at policy interventions that make most difference is about experience sharing across different practitioners. So if you have interventions that you know are working and you've got good evidence to show that, and you think that they could scale across OECD countries, these are the types of things that we can bring to our community of policy practitioners to see if there are interests in learning from one another. So these are exactly the kind of examples that we're looking for right now. And thanks so much to Augustine and Ken for flagging those. And Danny, fantastic to hear that you're going into the field now. I think it's So important, this point on intersectionality. We can only do that with really large sample, high quality data, and there's just not enough of it out there right now. So it's wonderful to hear that you have ambitions to reach so many households, and I wish you the best of luck with your response rates there. And again, fantastic that you're including a wide variety of measures, because we'll love to see that data and see the sort of statistical quality and which of those measures that you're using are proving most meaningful in terms of predicting other outcomes, in terms of disaggregating across groups. So yeah, I'm really looking forward to seeing some of your results, and thank you for joining us.
Thank you, Carrie. Thank you. We are collecting the remaining questions, so be sure that we are going to continue this discussion after today's excellent and inspiring webinar. So we are reaching the end of this webinar. So thank you everyone for participating in Carrie's webinar. Please be sure to participate in all of the ISQOLS webinar sessions, and also to follow us in social media, also including our new Instagram channel. We will be posting this recording and all the other session recordings in our ISQOLS platform soon. And thank you, Carrie, and everyone that participated. It was a real pleasure, and see you probably in the next ISQOLS regional conference in Buenos Aires, Argentina, in the 9-11 of March, or in the winter virtual conference that we are going to have during the 29 and 31 of January, or probably also in our annual conference in Kentucky, USA, in mid-August. So thank you very much, Carrie, again. Francesco, so thank you very much for giving your time to participate and give our insights in this excellent presentation, and to everyone that attended. So see you soon, and thank you.
Thank you. Bye-bye.
Bye.